San Diego, this is your Fox 5 News.
Coming up, ever wonder which cosmetic procedure is the right one for you, perhaps? Well, we're going to talk to a doctor right after the short break to see which one's right for you.
Well, with a quick prick, you can now freeze, fill, and fight the signs of aging. Board-certified dermatologist Dr. William Groff from the La Jolla Cosmetic Surgery Center joins me now to break down the treatment options and explain what's right for you. Good morning, Doc.
Good morning. How are you?
I'm great. Let's start right away with folks in their 20s. You have a model here, and would like you to tell me, first of all, what features you have, in your youth that we lose as we age, and what should she do now to maintain her youth?
Well, when you look at a youthful face, basically the face is shaped like an inverted triangle like this. So the patient has a lot of volume in their upper face. Which you'll see in Kimberly, you can see that a youthful face has a nice, smooth forehead, as you can see here. She has no wrinkles or creases around her eyes. The under eye area here, you can see, is devoid of any hollowing or shallowness. She has fullness in her cheeks here. There's no hollowing. She has nice, full lips. And you can see she has little to no fold here at the crease between the nose and the mouth. These are all youthful features which make her look good and healthy, and she's, in her upper 20s, so this is what we would expect.
And is there something she should do now to maintain?
Well, absolutely. Patients that are in their 40s and 50s don't have the advantage that Kimmy and others in their 20s and 30s have, which is nowadays we can do things to kind of prevent aging. So in Kimberly, what we like to do is, go ahead and scowl for me, Kimmy. You see how these wrinkles start to develop here? Well, if I put a little bit of Botox in this muscle here, that will relax that muscle, and she won't be able to make that scowl that causes the wrinkles to develop. Go ahead and elevate your brow. You can see the lines will start to form in this area, and again, we can place Botox in this area, and we can relax that muscle completely, again, preventing those lines from developing. So in a young female or even male patient, Botox or Dysport, which is the new competitor to Botox, they both relax muscles. They can be used to kind of soften and prevent really lines and wrinkles from developing in the first place.
Okay, now what I'll do is, Kimberly, I'm going to have you swap out with our next model, and while we're doing that, Doc, I do want to ask you though, go ahead, Kimberly, you can keep going, thank you. What I do want to say though, I'm sure there are people out there thinking getting Botox or fillers when you're 20?
Right.
Is that not too soon? Too much?
Well, it's actually FDA approved for patients as young as 18 all the way up to 65. So if you're interested in preventing wrinkling and looking as youthful as possible, no, it's not too young, actually.
And they won't have that Botox look,
Not when done properly. That's where it's important to find a dermatologist or a plastic surgeon who's board certified and has been doing this for years to get your best result.
That is very important. Board certified, guys.
So do your research. Board certified in dermatology or plastic surgery.
It's true. You're right, Doc, of course. Okay, let's talk about models in their 50s, the aging process and volumizers versus fillers.
Right. Well, Gretchen's beautiful. She's in her 50s. But things that can't be avoided are normal aging. And when a patient ages, when they get into their 50s, you start to lose volume in the face. And that is one of the biggest problems cosmetically with the aging face is volume loss. So if you look, go ahead and turn your head this way. One of the areas you see that in Gretchen is in this temple area here. You can see how there's a large void. And this is an excellent place for a volumizer like Radiesse or like Sculptra, which we can inject into that area and it will fill that back up, and it'll look like Kimberly's did, nice and full and youthful. Now you also start to see you get some lines and crepiness around the eye, and again, this is an excellent place where you can use Botox or Dysport to relax the muscle, and those lines will virtually melt away. In this area here of her forehead, again, you can see some lines developing here. And again, an excellent place for Botox or Dysport. She's getting some fine etched lines in her cheek here, and this is where we use a filler versus a volumizer. You can use a filler like Restylane or Juvederm to fill in some of these fine etched lines here. You can see if we turn her head that as a patient ages, they lose that nice crisp jawline here. So you can start to get this kind of in and out kind of jowling effect. So what we can do is we can put some filler right here along the jawline, and we can give her that nice, straight, angular jawline that she had in her youth.
I want to move on. Thank you, Gretchen. You do look beautiful, by the way. Honestly. And let me bring in the male model last, doctor, because we're talking about male models. We're talking about folks in their 60s and men using cosmetic surgery as well as fillers becoming a growing trend.
Right, absolutely.
What are they getting that women don't necessarily get?
Well, men represent about 20% of our patient population right now, and that's continuing to grow. Men are becoming more and more interested. For men, one of the most common injectables that they like to have performed is Botox, because Botox has absolutely no downtime. It's the safest thing we do in our practice. We do surgery, we do lasers, but Botox is absolutely the safest thing you can do. You can go right back to work, not miss any work at all. So, on Stephen, you can see where he's getting these deep etched lines around the eyes. Again, excellent place for Botox here. He still has fairly good volume in his cheeks, but you can see under the eyes he's starting to lose some volume here. So that's a great location where we can use one of those dermal fillers like Restylane or Juvederm.
So the bottom line is people are getting it. You have to make sure you go with someone who is board certified, whether that's for fillers or plastic surgery. If you want to go see Dr. William Groff, he's at the La Jolla Cosmetic Surgery Center. We'll put his information on our website. That's on Genesee Avenue. Thank you very much.
Okay, thank you.
Yep, see you next time.
Okay, thank you.
All righty, Raul.
Okay, good stuff, Arthel. Thank you.